Hi everyone, I'm Robin Gregory from the Northern Integrated Family Violence Services team, and I'd like to start by acknowledging that we're on Aboriginal land and to pay my respects to all Aboriginal people, including elders past, present and emerging, and also to acknowledge that sovereignty of this land was never ceded. This is the service system overview series, and in this interview I will be interviewing Peter Coburn from Uniting to talk about men's behaviour change program. So welcome, Peter.
Thanks, Robin.
And I'd like to start by, could you explain what your service does and who can access it?
Sure. Well, I'm part of Uniting's family violence intervention program, and we run a number of men's behaviour change programs on behalf of court services, on behalf of the Department of Health and Human Services, and also the Department of Corrections. We also offer services to men who self-refer into our program. And a big part of our program is providing family safety contact for the affected family members, women and children who have experienced violence at the hands of an intimate partner or parent. That's the main part of our program that runs in parallel to the work that we do with the men. We do a thorough assessment of men when they first come into the program, and once they're allocated into the program, there's an obligation on them to attend up to 20 group counselling sessions and 4 individual counselling sessions.
Great, thanks Peter. And could you tell us more about what both perpetrators and victim survivors could expect when they engage with your service?
Sure. Well, the first thing we do is, as I said, conduct that thorough assessment of the man. That's done over 2 one-hour appointments, conducted 2 weeks apart. In between the 2 assessments, we make contact with his partner or former partner and talk to her about the support that we can provide her as he goes through the program. So as I said before, it's a parallel process. During the assessment process, we work with the man in particular around some goals dealing with safety and accountability that he can work towards as he goes through the program. Once the assessment process is done, then he is allocated into a group, and his partner or former partner is allocated to a specific family safety contact worker who guides her through the program, offering her support around her experience of his behaviour, developing up safety plans for her, making referrals to other services as the man goes through the program. The work we do with the man is really around taking him on a behaviour change journey.
Importantly, Peter, how can workers refer into the service, and what would they need to be aware of when making a referral?
Well, workers can definitely call us to discuss referring a man into our service. However, from there, we would ask that the man contacts us directly so that we can do a thorough intake. And that intake process is important to outline the obligations and expectations that we have of the man to commit to the program. There may be reasons why the man is not going to be suitable that can be determined at that intake time. So, for example, if a man is geographically located out of the northeastern suburbs of Melbourne, then it may not be practical for him to attend our group, or he may not have the transport to be able to attend and commit to attend for all the sessions. Alternatively, if a man or someone on behalf of the man is looking for a program that is more along the lines of anger management, then that's not what our program does. Our program is very different to an anger management program. There are a lot of obligations, as I said, and expectations of the men who enter our program, particularly in terms of attendance, in terms of their participation, in terms of how they conduct themselves in an appropriate manner, in the group counselling in particular, and also obligations around providing us with updated information as they go through the program. So another thing to be aware of is that the man must provide the details, the contact details of his partner or former partner. Otherwise, that could compromise him getting into the program. So that's a condition of him entering the program. Another thing to know is that our programs are free. And in terms of the practice framework that we apply, I think it'd be good for other practitioners in other agencies to know that Uniting's family violence program applies a feminist framework that acknowledges the gendered nature of family violence, and we work with men around their attitudes and beliefs towards male privilege and exercising power and control in relationships.
That's terrific. Yeah, that's really detailed and useful for workers to know. So, you know, in terms of secondary consultation, you know, the Marram framework highlights the importance of workers doing secondary consults, particularly with specialist family violence services. So can workers ring for a secondary consult, Peter?
Yeah, definitely. Workers simply need to call our reception area, our intake worker, and ask for the relevant person who's been working with that man. And they will provide that secondary consultation. We really encourage secondary consultations, particularly so that workers working with men who belong to other agencies can understand how he's addressing his use of violent and harmful behaviours. So if a worker is working with a man around whether or not to give him access to his children, around his parenting, or around his relationship with his partner or ex-partner, we think it's important that they take into consideration the impacts of his violence on those people, affected family members, and also how he's addressing his use of violence throughout the men's behaviour change program. So we really encourage working in an integrated way with other agencies across the sector to ensure that we're working towards increasing the safety of women and children. I think it's important to understand that men's behaviour change work is complex work, and the journey of change for each man is going to be different and never linear. So there's always going to be ups and downs. And we engage men on that journey of change, and we invite them to think critically about the choices that they've made in the past to behave violently, and point them towards the non-violent choices or choices that they can make to be non-violent in the future. And for many men, it's difficult to even contemplate making that change, because real change is about giving up on things like power, giving up on things like control and privilege and entitlement that have, to their mind, become the norm for them and served them well up until that point where they've come before the court or come before police and face the consequences of their behaviour. So as men navigate through that journey of change, the risk to affected family members is often quite dynamic. So it's really important to be vigilant around assessing and managing risk ongoing. And that's why we think it's so important that all agencies working with the man and the affected family members, his partner and children, work in an integrated response way.
Terrific.
Yeah.
And lastly, Peter, we know demand on the service system is huge, and on men's behaviour change programs continues to be. So if workers can't make a referral at that point because you've closed your wait list or whatever, then what should they do then?
Well, we would refer men to the Men's Referral Service, who would have, I guess, a lot more information about other types of services that men could tap into if they weren't able to be offered a service by Uniting. And those sort of services could be other group programs for men around safe fathering or caring dads, for example, or even individual counsellors that work in the area of family violence and have a good understanding of the gendered nature of family violence.
Terrific. That's fantastic. Thanks so much for your time today, Peter. And, all that you've said will really help workers understand more about men's behaviour change programs. Thanks.
Great. Good to join you, Robin.